My name is Anthony Philippakis, and I'm the Chief Data Officer at the Broad Institute of MIT and Harvard. The last 30 years of medical research have been marked by two trends. So first is just enormous growth in the sheer quantity of data that we have. My group at the Broad currently manages more than 100 petabytes of data. With that in perspective, the entire movie corpus of Netflix is only around 2.5 petabytes. The second trend is realization of the importance of data sharing. No one organization, whether it be a university, a healthcare system, or a company, has enough data to answer important questions such as the genetic basis of disease or, the identities of all cell types in the human body. And so to get at these questions, we really need to be able to share data in a way that's secure and compliant. I think there are very few people who doubt that one of the really important areas for medicine to go is precision medicine, which is to say finding the right therapy for the right patient. Now, one of the things that this relies upon is having the data to better sub-stratify patients and understand more about them so that we know what therapies will work or, just as importantly, what therapies will not work. One of the big problems with health equity is that so far, there are many of our studies for generating data on patients have not been as ethnically diverse as they could be or as socioeconomically diverse. A classic example of this is in polygenic risk scores. So recently, many of my colleagues at the Broad and elsewhere have pointed out the opportunities for being able to predict health outcomes from your genetic sequence. One of the challenges is that most of our genetic studies have been done in the Caucasian population. And so when we have tried to apply them to other ethnicities, they don't work as well. My talk will focus on the work that my group does at the Broad to build out data platforms to support public health and health equity. In particular, I'll be talking about our efforts in the All of Us cohort program, which is an effort to recruit 1 million or more Americans, collect full medical records on them, full genome sequences, with a real emphasis on diversity and health equity, and really develop a research cohort for the 21st century.